Just when you thought it couldn't get any worse for Zimbabwe. The country is already in political turmoil, with President Robert Mugabe widely reviled. The economy is one of the worst in the world, with the currency almost worthless. And now, a deadly cholera outbreak caused by contaminated water. A state of emergency has been declared as more than 550 people have died. The story from the CBC's Adrienne Arsenault.
Too racked with cholera to realize it, but this young man is lucky. A Zimbabwean who escaped to South Africa to get help, treated in the open in a border town clinic because back home there's nothing.
If you got cholera in Zimbabwe and you don't manage to buy your own drips, you don't manage to buy your own medication, there's no public health to talk about. You definitely will die.
Cholera is a disease of the deprived. It doesn't usually kill, but it does in Zimbabwe now. The UN says nearly 600 people have died since August, likely more. 12,000 are infected and half may not make it. Failed by life's basics. Water supplies, even in main cities, are contaminated, often cut off completely because Zimbabwe is out of purifying chemicals. People are told to boil what they use, but it's not that simple.
We don't boil the water because we don't have electricity, don't have money to buy some firewood.
They chance it with cholera-infected water and sewage runs freely. And this isn't the only crisis. Panic this week as unpaid soldiers rampaged and turned on civilians. Doctors, nurses, and teachers protested too. They aren't earning enough to even pay for the bus fare to work. Electricity is erratic, medical supplies low. Hospitals are closing. Here, bodies pile up in a clinic toilet.
W Radio Africa.
This easily treatable disease is now out of control.
Far away, a British radio station broadcasts via shortwave into Zimbabwe, a rare independent voice for a nation consistently manipulated by Robert Mugabe's regime.
In summary, what has happened?
Reports from the ground are of a steadily unraveling nation.
You can detect the anger in their voices as you speak to them. But also they're very careful what they say because they're not very free to express themselves.
For months, Zimbabwe's government insisted cholera was under control. It now admits that's not true, and it urgently needs help. As the sick and dying scramble across borders, this is fast becoming a regional emergency. Adrienne Arsenault, CBC News, London.